you already registered, then you know you don't need to proceed with the link and the QR code. So thank you for doing that. Again, good morning, everyone. Welcome to today's webinar, Create Your Best Life. I'm Brenda Helgett from A Time to Heal Cancer Foundation. Thank you for taking the time to join us today. We are very lucky and blessed that we have this webinar series, thanks to our wonderful friends at Nebraska Cancer Specialists. And if you would like to know more information about them and their wonderful providers and the services that they do, you can go to nebraskacancer.com and learn more there. Okay, and I'm going to go ahead and stop sharing here and take down the PowerPoint. There we go. Because we want to get to this wonderful session. So I'm going to introduce you today to Alex Eilers. She is a doctor of physical therapy, currently practicing at Madonna Rehabilitation Hospital in Omaha, Nebraska in the oncology unit. That unit is accredited by the Commission on Accreditation of Rehabilitation Facilities. Can I just take a moment and tell you folks how exciting this is? Do you realize that cancer rehabilitation really has not really existed until recently, or at least called that, and actually been something that was thoughtful and meaningful and put together. Now, here at A Time to Heal, our founders actually lamented the fact that there weren't any cancer rehab programs, and that's when they started A Time to Heal. We're celebrating our 20th year, but we're so grateful to Madonna that they are really focused on doing this purposeful and meaningful work to rehabilitate cancer survivors. So Alex completed her undergraduate career at the University of Nebraska-Lincoln. She later earned her doctoral degree in physical therapy from UNMC, University of Nebraska Medical Center, in 2019. She has over 2,000 hours of experience. She provides comprehensive care and rehab to oncology patients. And today she's going to be speaking to us about neuropathy, which is, of course, a common side effect of cancer treatment, whether that's through medication or chemo, et cetera, et cetera. While it's often temporary, some individuals experience lasting effects. I'm one of those individuals that has neuropathy, and especially in my right foot. So this presentation is going to really define that. We're going to talk about some of the different approaches for managing symptoms. And Alex, thank you so much for being here.
Yes, thank you for having me.
And we're going to get started here. I'm going to let Alex go ahead and get her screen going and everything. And I'm going to kick off with a question already, because I think Alex would like to talk about this first and foremost. So Jackie Viets, I don't know if Jackie's in here today. Jackie, hi, how are you? Jackie has neuropathy from taking a medication that I can't pronounce. And then she has it from about her knees down through her feet. And it's getting more noticeable as it travels down her legs. And she tried gabapentin, but she didn't like the way it made her feel. And then she tried reducing the dose and then just stopped it altogether. So she wants to know, what can I do to help symptoms, as the doctor tells me it will never go away?
Yes, Jackie, thank you for your question. And I think you are in the right place, because we're going to discuss different things that you can do to hopefully help those symptoms that are not associated with medication. I'm not a physician, so I won't really touch on the medications. There are some available that are worth trying and worth discussing with your providers. But I will be speaking more to the holistic side of the things you can do outside of medications. And so thank you again for that wonderful introduction. I am, again, currently working at an inpatient rehab facility. So we see intense rehab where patients are actually staying in the hospital for rehab specifically. I've been there for about 5 years, and I am one of the co-leaders for the Oncology Education and Survivorship group that we host. And also this talk is a lot inspired because I just sat for my oncology specialty certification exam in March. And so I learned a lot of information and some more things that we can do to help these ongoing symptoms that people see. I really love this title because it does speak to like, we're talking about your nervous system and your nerves, but also that persistent feeling or non-feeling can be very annoying. And so it affects your life. It affects what you do and how you do them and what you're thinking about. And so it can have an impact on your quality of life as well. The good news is cancer treatments are getting better. They're improving. People are living longer. But due to the intensity of the diagnosis and its treatments, you don't leave that whole process unscathed. And unfortunately, there are some lasting side effects. And so I think that's where physical therapy and the therapy profession really fits in to this cancer care because we are equipped to address those things. We can work on holistic strengthening, body functions. Therapy is all about function, all about managing pain and getting you back to doing what you want to do and what you love to do. And so I think we have some tools to address neuropathy and other symptoms that may persist. And so again, little plug for therapy on this front. Again, more of a new kind of wave of understanding that therapists can have a big impact in people surviving during and after cancer treatment. So again, my background is in an inpatient facility where we treat pretty drastically impacted neurological diseases. And so I have a pretty strong background in describing what nerves do, how they work on a large scale with people not being able to move very much at all because of their disease and the impact that it has on them. But also I can kind of talk a little bit more about the less serious side of neuropathy and hopefully see some results with that as well. Please feel free to ask questions ongoing. You can put them in the chat. You can unmute yourself on your speaker if you have something. I will have points where we kind of break and take a minute to kind of reflect and see if anything pops up. So again, I would love this to answer your questions specifically. And so if you have them, please feel free to share. And so quick, just kind of a roadmap of where we're going. Today, we're going to define chemo-induced peripheral neuropathy. So we all are talking about the same thing. We're going to discuss some screening tools and symptoms that it may present with, and also some interventions and resources to continue to treat that on your. And so first of all, the definition, chemo-induced peripheral neuropathy, I will be calling it CIPN from now on because it's a little bit less of a mouthful, but it describes damage to the peripheral nervous system incurred by patients who have received a neurotoxic agent. So usually that is a form of chemo. And so let's start with what is the peripheral nervous system. It is the electrical system of your body that helps communicate with your distal extremities, so the farthest parts of your body, to your brain, which is like the big processing center. It takes information from the environment called sensory information. So what you feel, where your body is in space, and provides that to your brain so you can make decisions, as well as your brain uses the nervous system to send a signal out in order for you to move your hands and your feet. And so it works like an electrical system. It serves electrical impulses back and forth. And that's how that message is processed, kind of like the electrical system of your house with different signaling.
Alex, could you maybe adjust your microphone? Some folks are having trouble hearing you and they're kind of going, sometimes you get a little too far away from that mic and then you cut out a little bit.
Is that helping?
I think that's better.
Okay,
Folks,
I'll just kind of hold it here.
Yeah.
Let me know again if you still are having an issue hearing me, and I can maybe just switch to my computer.
Thank you.
Computer screen as well. Was there any missing pieces that were really bad that I need to review some of what I just said?
I don't think so.
Okay, awesome. And so CIPN specifically affects the small fibers. And so it looks like a branching system where your brain and your spinal cord is very thick at the top in the middle. And as it goes out towards the rest of your body, it becomes smaller and smaller, kind of like a river branches into smaller and smaller areas as it goes. And so you can kind of see in that picture, there's a lot of little lines on there. That is just kind of mapping out how each muscle is innervated and is touched by one of the nerves. And that is how we get all of this information that we were talking about. And so again, the peripheral nervous system is affected by the small muscle fibers. And so the farthest reaching parts of your body. So mostly happens in your hands and your feet. And it will start in that area. And if it gets worse, it may come closer to the center of your body. And so this can be interpreted and received as burning, tingling, numbness, loss of sensation, changes in hot and cold temperatures. And this is really, why does this happen? It's really due to different factors and can change between what medications you're receiving and what the cause is. And so one way that this is happening is that the myelin is being affected, which the myelin is just like the plastic surrounding of a electrical copper wire. So if this coating starts to not be maintained or destroyed because of some of the medications you're taking, it can inhibit the signal. It doesn't go to the right places. It may just stop altogether. And so it affects the conduction of that signal. And so that's what that picture shows. It's kind of those exposed wires because the myelin sheath or the plastic coating is kind of being kind of eroded away. Another mechanism is that the ion channels are not working correctly. So this can cause a gap in the signal being passed. So think of like a loose battery in a flashlight. And if it's wiggling around, it's not passing through that, and the signal gets interrupted and that light doesn't turn on as consistently as it should. And so these errors in transmission cause incomplete, absent, or inaccurate messages that are interpreted as symptoms. So your brain is going, okay, this is not what I'm thinking is going on. It's not what I'm seeing with my eyes. My feelings are not matching up with all of my other inputs and understanding of my environment. And so that is can manifest as that burning, numbness, etc. And so chemo-induced is usually induced by a drug of some sort, and it's specifically associated with neurotoxic agents, so affecting the nerves, which is what we're talking about. And they are very common. These things that are listed are used in a lot of cancer treatments across the board, different varieties, different diagnoses. They include platinum agents, taxanes, vinca alkaloids, and others. If you want more specific side effects for your specific regimen, I would direct you to your providers, your oncologists, and your primary care providers, and ask specifically about the short and long-term effects of your regimen. And you can always go back and ask this question, even if you're out of treatment for years. So.
Thank you for saying that. I was just about to ask, folks, she just showed you how, it maybe starts, just in your hands and feet. And then if it's starting to move up, maybe, I don't know how much time can pass between that happening, Alex.
Yes, depending on the specific drug, there is a coasting effect for some of them. So you might not notice it right away, but it may start to affect you a couple weeks to months down the line. If it is specifically related to chemo, it should start to manifest early on, but it doesn't mean it will not progress as it goes. Other things that may impact you is your other health aspects. So if you have like a history of diabetes, CIPN kind of aligns with peripheral neuropathy due to diabetes. So that could compact and impact your peripheral neuropathy symptoms and other things like that.
What about even poor circulation? Can that
Yes.
also
Yep,
heighten that?
definitely. Poor
Okay.
circulation can affect it. You know, it's one of those, like I said, there's a variety of treatments. There are a variety of other health issues that may compound it. And it's hard to predict if you're going to get it or not. And so I think this is kind of, you know, one of those gray areas where it could be due to this, it could be due to something else. And that's another reason why it's hard to treat, is because we really don't know the true mechanism. I gave some options for reasons that it might be, but there's a variety of other things that like physiologically might be causing the peripheral neuropathy.
Alex, someone has a question that maybe is a little is relevant to that wonderful graphic you showed,
Sure.
showing the nervous system. What do you know what the nerve growth rates are, and what is the distance to the hand and feet on average?
I do not know that. It probably depends on, you know, how tall you are. Obviously, there are some differences between body types. The regrowth rate is very slow. That's one thing to think about with this. Is when you're regenerating those nerve fibers and the myelin sheaths, it can be 1 millimeter a week is kind of the set point. And so you're looking at miles of surface area contained in your body. I do not have a number for that. That would be an interesting thing to look up. But it is a slow regenerative rate. And so a lot of the things that the things you're going to notice first off aren't getting better, aren't going to be necessarily true healing. It's going to be your body figuring out other ways to interpret this information.
Thank you.
Thank you for asking those questions. You know, another thing to note specifically about the medication piece is that there is a cumulative effect. So the higher doses of chemo you receive, the more likely you are to have side effects such as CIPN. And then also if there's a compounding effect, so if you have multiple neurotoxic agents, it might also, you know, not just be one of the mechanisms that we discussed, but multiple.
Alex, can maybe we could ditch the microphone? There's just a lot of breath noises and things like that. I think they're distracting people a little bit.
Sure.
Oh, that's
Is that any
great.
better?
Oh, yeah, that's
Okay. I thought the microphone would help because you know, there are some things going on in my house, so I was trying to drown that stuff out. But overall, it's pretty quiet. So
good.
we'll just go without. Let me know again if this is if the sound is an issue. So moving on to the next slide, CIPN is common. It's the most common neurotoxic associated symptom with cancer treatment. It can range in severity from just noticeable to impacting your sleep, clothing choices, and balance. It may get better over time and possibly go away, or it may stick around. Like, you know, that one participant shared, the doctor expects it to be permanent. There's also a coasting phenomenon with some chemos, which we kind of addressed. So it might not happen right away, but it might happen down the road. And CIPN can be so bad that the drug regimen may be changed or reduced if you are currently going through chemo. And that can obviously have some effects on the effectiveness of the treatment. And then due to possible sensory and strength changes, balance may decrease, causing a great risk for slip, trips, and falls, which can be just a secondary effect and secondary setback if you do unfortunately have a fall. And really what the research shows is that this annoying nerve issue can affect your quality of life, which is what we really like to address as therapy. And, you know, everybody wants the highest quality of life possible. So now we're going to kind of move on to some of the symptoms that, how do you screen for it, and how do you kind of know if you have CIPN or should be asking your providers a little bit more about this. And so I've included a few patient-reported outcomes that are recommended by the oncology section of the American Physical Therapy Association, because they've been validated in the oncology population specifically. And so this first one is called the FACT-GOG-NTX. It stands for Functional Assessment of Cancer Therapy, Gynecological Oncology Group, Neurotoxicity. And it's a questionnaire that ranges from not at all to very much. And they want you to ask you about how you feel in the last week. And so the questions on there include having numbness or tingling in your hands and feet, discomfort in hands or feet, having joint pain or muscle cramps, feeling weak all over, having trouble hearing, ringing or buzzing in your ears, have trouble buttoning buttons, or feeling small shaped objects, or having trouble walking. And so the questions are fairly simple and gauge how this is affecting your life. Numbness and tingling, can you identify that? What is it rated? So really, if you're having some of these symptoms, it is possible that you have CIPN and maybe need to get it addressed.
Alex, I hate to sound complaining, but my old eyes struggle with small. So if you could make this maybe full screen or something, maybe that would help us see it a little bit better. My sisters on this that are have more birthdays than others. Appreciate the help.
Sometimes I'm not necessarily aware of how it looks on your end. So
and it's still, I think you need to do full screen, I think, on this whole, because we can like see the top of your browser.
Let's see.
Does that make sense?
Yes, it does. I'm just not quite sure how to do that.
Yeah, that little box maybe. No. I'm seriously not the person to tell you. Well, or just even zoom in a little bit. Folks, sorry about this, but she's doing a great job of telling us what, if it's small, I'm sure she'll read it for us. And
yes, I'm sorry.
We can always zoom in later and that's fine, but thank you. I feel like I'm doing nothing but complaining. I'm so sorry.
I'd rather get it right than not.
It might give you more area if you do the X where it says Google Chrome isn't your default. Yeah, it might give you a little more area.
Yes, thank you. So you still see my browser, but
that's okay.
I am in presenter mode, so usually that takes you away. So I don't know.
I'm just glad they can't see mine. They'd probably see like I was shopping or something.
Yeah. And so this is one of the other tools that is recommended, and it kind of similarly looks like the other one. It's called the Patient Neurotoxicity Questionnaire, and it has you rate your numbness, pain or tingling, and weakness in arms or legs on a 5-point scale, and then allows for you to identify specific tasks that are challenging, like, for example, using utensils, dialing telephones, opening doors, if you're having issues with sleeping, stairs, walking, riding, or even driving. And so it really just is asking you about 2 different symptoms, but all of those different functional tasks that can be affected because of that. And so I think this really demonstrates how much of a quality of life influence it can have if you're having issues doing your daily tasks, just with those 2 different symptoms, weakness and numbness and tingling. Other things for some of the providers that are in the room that may be appropriate is the CIPN assessment tool and the total neuropathy score. These include a little bit more physiological information, including using monofilament testing and a tuning fork to kind of see exactly if there are some physiological changes that we're noticing. And then of course you want to assess balance in some way using, things like the 10-meter walk test, the tug, modified CAT-SIB, or the 9-hole peg test. And those are for the providers. So if you don't quite understand what those mean, don't worry about it. They're just tests that kind of give a score to how your balance is and how your hand grip is. And again, I think I kind of touched on this a little earlier, but the growth rate for the nerves is very slow. And so you're looking at more of those compensation areas is where you're going to see the most improvements right away while you're waiting for that physiological growth and healing. And so again, expecting to see kind of like some compensatory improvements versus actual healing. So kind of what do you do about it now that you kind of know that you have it and you're experiencing these symptoms? We have identified that it is a true nerve problem. And so how do we address that? We address that through what the nerves do. So the nerves provide sensory information. And so there are some things we can do to help with your sensory system. It provides that movement cue. And so it can manifest as decreased strength in your extremities. And kind of those two together is what makes up your balance and can impact your balance. And so again, there's a lot of variety in this. And so one area may be affected more than others for some, where you might have some variation between these systems.
Alex, I have a question from the chat box. And I bet you're probably getting to this, but someone said they're currently seeing an acupuncturist for neuropathy, and they're seeing some improvement, which is really exciting. Their oncologist says if I'm seeing some relief, his experience indicates that he might continue to see improvement in their neuropathy. Do you agree with that?
Yes, definitely. Acupuncture, I haven't touched on it in this presentation, so I'm glad they brought this up. But I think the idea behind it is you're improving blood flow to that area, and you're creating some more attention and sensory input to that area. And so that is, you're spending some dedicated time on your feet or hands, depending on where the neuropathy is. And that is why that improvement is seen. So yeah, definitely fits into kind of that sensory aspect of an intervention.
Alex, one more question. If one is suspecting they have neuropathy, is there a certain type of healthcare provider that they need to contact? Should it be an oncologist, or who should they contact?
Yes, and I think that's one of the tough things about neuropathy is it is not a life-threatening symptom. And so it can sometimes be underreported, underaddressed by your healthcare team. And so really, I would just say it's you are feeling the symptoms and tell it to everybody. Because this is kind of where I want you guys to advocate for yourself. And really, you're going to get the best care if you say it and say it again and keep saying it. Say what you've tried and say, how it's affecting you. Specifically, sleep is a big one that people, if you're having a hard time sleeping because of it, this really does need to be addressed because that affects your healing, that affects your mood, that affects your quality of your life. Especially from my perspective, that would, if I don't sleep well, I'm not a nice person. So again, saying why it's affecting you, how it's affecting you, tell them what you've tried. You can speak to your primary care physician, you can speak to your oncologist, you can just be persistent. And if it is your number one issue, then it needs to be addressed. And, I think you guys are being self-advocates because you're in this talk. And so, really speaking, sometimes you got to speak the language of the healthcare providers, and that can be challenging. But if you are persistent and say, this is affecting my quality of life, that's kind of one of the things, it's affecting my sleep, or this is my biggest issue right now. Those words can kind of like highlight someone to say, okay, we actually need to address this and think of some ways and get you hooked into some things that may help.
Alex, I think that's absolutely key. Folks, you've got to say those key words of this is affecting my quality of life, or this is affecting how I'm not able to work, or I'm not able to do this or that. And unfortunately, in this day and age, I feel like a lot of our providers have to hear something very specific like that in order for also insurance to cover it.
Yes, that's
So
true.
they're being a little bit handcuffed here. But I also agree with Alex, is if your doctor is just shrugging and saying, oh, well, you just have to live with it, get that second and third opinion, and just keep going, and until you can, hopefully get help, or maybe if the message is consistent, maybe that is going to be it. But I think a lot of times they just don't know what to do.
Yeah.
And also, Alex, for me, even just listening to you, it may not even be a physician. Maybe you go to a physical therapist.
Yeah. And that is something, sometimes you can just ask for a physical therapy referral, depending on where you are. I know we have people all over this country. You may have direct access options. Nebraska does have direct access to physical therapy, but a lot of times insurance won't pay for it. So you do have to jump through that hoop of going to your primary care physician. But overall, the physical therapy world, if you specifically ask for it, most physicians will not say no. So you can ask for that specifically. I had another point, I can't remember. Oh, the other thing is write it down before your appointment. So when you're preparing for your appointment, you're bringing maybe a medication list, you're bringing some things to your physician, have your list of questions, and make sure that this is on there so you don't forget, because it goes fast. You get in the room and you see them and you're like, oh, I forgot to ask that question. So that would be another tool to make sure that all your needs are being addressed, is that you think about it beforehand and you write it down, because you get going and you start small talking and you're like, wait, I actually had some concerns I wanted to address. So that would be another tip that I have for you to plan for your visits and make sure you're getting these problems addressed. Awesome. Thank you for all those questions. And so we're just going to go into kind of each section and things that you can do to address that specific symptom that you're having. And so those sensory impairments usually manifest as burning, aching, cramping, that pins and needles sensation, or even numbness. And sometimes they are reported to be worse at night and cause sleeping problems. They can increase in your actual sensitivity. So although some as report numbness, others report increased sensitivity. So even just like a light touch can kind of cause more reaction and uncomfortable feeling. And so what you're trying to do with these sensory interventions is to increase that sensory input. So non-harmful stimulus, to help kind of get used to feeling things again. And so things like that will help with that is like a warm foot bath, putting lotion on your feet afterwards, and nice warm fuzzy socks. That also increases blood flow, which can increase your healing rate. Another option is, this is kinesio tape, the pictures on the side over here, which just is, for the providers that are aware of it, is just like a piece of tape. It's special tape that's like stretchy, and you can cut it into strips. And you want to make sure, and this has shown good research in the diabetic peripheral neuropathy, where you start kind of at the nail bed and wrap around on the back side of your foot in long strips. You want to make sure those strips go to the point where the peripheral neuropathy stops. So where that normal sensation begins is where you stop that tape along the calf of the back of the foot. So that's one way to increase that like touch sensation for a prolonged period of time. Compression socks can also do that, kind of give that a little bit more sensory feedback, where it's just putting a little bit of pressure in that area. And then the one that I really want to focus on is this foot massage, looking at increasing blood flow, kind of some similar aspects as the pins and needles that you're putting in your foot. I'm forgetting what it's called right now. You know, with that increased blood flow, increased sensation, you're looking for those like knots in your feet to kind of push out, especially along the bones of your feet. So like the knuckle area of the foot or the hands. And I will provide a video that goes through that step by step at the end.
Oh, good. I was just going to ask about that. And then James, he's such a rock star today. He has the most fascinating question. So he said, can you please comment on electric gloves and socks?
So is that like warming electric gloves or like a TENS unit where you do electrical stimulation?
James, can you comment on that, or you want to come off mute? And
It's just battery operated socks and gloves.
They warm your feet?
Yeah, warm your feet
Yeah.
and hands.
Yep. And so that the reason why that might help is that you're increasing blood flow. And so, you know, that's another reason why that warm bath helps, is you're increasing blood flow and then trying just to keep it warm. So that can kind of, as you get cold, the very distal parts of your hands and feet tend to kind of lose that blood flow because you're keeping it more centralized. And so as you warm up, you increase that blood flow to those areas. So yes, definitely, you can use it. There also is some research that you might want some guidance on a little bit of electrical stimulation to that area can also provide some relief, kind of with that sensory input idea.
Alex, I have one of those foot massage things that my kids bought me. They're not very expensive and it has heat. So is that and you know, I've used it only a few times. And I do have neuropathy in my feet. Should I be using that more on a regular basis?
So I will provide some more, especially with that foot massage piece. There is like a protocol that I have found that says 3 times a day. And so that's very frequently. You know, if it is something that's bothering you, I think the more the better, honestly. And the other thing that's important with the massage is trying to get to the places that aren't touched as often. So specifically between the toes and between like the fingers in this area, and all the small muscles in here can get really tight and really kind of angry. And so spending time on those places is important as well.
Okay, everyone, we all need to give Alex a big thank you, because all of us that have partners, guess what they need to do now? Oh,
yes,
sorry, you have
to
rub my feet.
Just know you have to pay back in some way. So that might go over a little bit better, right?
You know, or you have to buy me the warm, you know, the water massage thing for my feet. Sorry about it, doctor ordered.
Yeah, and it is pampering, but if it helps, like, why not try it? Especially our first question says the medicine wasn't helping, and so this is very low risk. It does take time, but it is, if it's going to help and it'll help in the long run, it may be worth it.
Love it.
Awesome. Okay, we'll move on to that strength aspect. Weakness may manifest with continued CIPN. You're not getting that neural input, so you might even see some like what's called muscle wasting, especially in the hands. You can see it like it's called the thenar eminence right here. So it's like this fat pad that's in here. I can't see there. Like this area might seem like it's a little bit more thinner in that area. Could be one way that it manifests. And that's just those small muscles of your hands and your feet being affected. And if it's severe enough, especially in the feet, that you can't pick your toes up when you're walking, it may be very important to add some bracing to help with that. If you're unable to pick your toe up, that increases your fall risk, which again increases your secondary chances for injury. And so that's one option. The other is working on those small muscles to maintain and increase their strength. And so ankle exercises are really important. You're thinking all 4 directions. So up, down, in, and out. specifically for the ankle, I will provide a video for those. You can just do it with resistance bands. And then for your hands, specifically grip strength. So you're thinking those squish balls, stuff like that can help improve your fine motor skills. Putty, a lot of times our occupational therapists will use putty and have you pick through that or squeeze it. And then of course, overall fitness is going to help you in general. So aerobic exercise is also recommended. So a walking program, biking, swimming. The biggest tip I have for you with that is to find something you like, find someone you like to do it with that can keep you accountable. And the overall recommendation is to sit less, move more, and really strive for the recommendations for healthy lifestyle, which is 75 to 150 minutes per week of moderate to vigorous exercise. And so, I mean, I could talk about that forever if you want me to, but I will just leave it at that for now.
And Alex, thank you for that. Can I just interrupt with something?
Yes.
As a cancer survivor myself, and folks, I don't know where you're all at in your cancer journey, but if you're fairly recent, I know when Alex is talking about exercise, you might be inwardly groaning and saying, oh my gosh, I barely have enough strength to walk across the room, let alone running or biking. Here's a great way to get started. I have found, if you like to talk like I do, every time you get a phone call, get up and walk around as you're talking on the phone. It does two things. Number one, you get steps in like you wouldn't believe. And number two, you're not actively thinking, oh God, I'm walking. Do you know what I mean? And it just, you all of a sudden you're like, oh wow, 10 minutes has gone by and I've done all these steps and I didn't even realize.
Yeah.
So just as this easy way to get started, I think.
Yeah. And kind of going back with the recommendation is to sit less. And so if you're doing that, if you're walking around while you're talking on the phone, if you get up to let the dog out, instead of going right back to watching TV, you do a lap around the house, it all counts. And so again, you mentioned talking on the phone. That sounds like something you like to do, maybe pair it with something you like to do. So again, yeah, they can be small goals, and small things can make a big difference. So raw exercise. Thank you. And then again, that third one, which kind of incorporates both that sensation piece and the strength piece. So if you're addressing both of those, you are already addressing your balance. But because those two things are impaired, your balance can be reduced. And the big thing with balance is that poor balance can lead to falls and secondary injuries. And so obviously we don't want that setback when we're trying to get better. So, you can do things like standing on one leg, managing uneven surfaces, and then task-specific training is important. And so this may be better served for you under supervision with a professional, either like an exercise trainer. I know the Livestrong, I think Amy was signed up. So definitely seeking out some community resources if balance is a specific concern of yours. Especially, that's another reason that you could ask for a physical therapy referral from your provider, or if you are able to go straight to your therapist, you sure can. Yoga and Tai Chi have been shown to improve balance in the general population. So if you have access to those things, that would be an option. And then one thing everyone can do is wear well-fitting shoes, something with a sole that has the toes covered. That can improve your balance. It also protects your feet. So if you're having, if you're not having that full sensation, you might not notice if you bump into something, if you're stepping on, if you have a rock in your shoe, you might not notice some of those things that may cause some getting a blister. You might not feel that happening. And so it's important to protect your feet, and then also make sure that they're clean and don't have any wounds on them. And overall, I know this is very general, but really it's important that these interventions are individualized for them to be effective. And so general is best for now, just because of that.
Alex,
Does
do you have
anybody-
another question?
Yes.
If you don't mind. This is actually just about a dietary supplement. And again, I know, Alex, that's not your area of expertise, but it's called NeuroRenew. And we wonder if you've ever heard of it.
I have not, and I would definitely direct that to either a dietitian or a physician.
Yeah, and also, especially your oncologist, if you're taking other medications, you never know about these supplements. Clear it with them first.
Yeah.
You never know, there might be something in there that could interact with something else you're taking.
Right, and you don't want some of those medications that you're having side effects for positive things to be negated because of the supplements you're taking. Yes, very good point. All right, and so next I am sharing this this resource, drkatydpt.com. I'm going to go ahead and pull that up, is where a lot of these videos that I have are coming from. So hang with me while I try to share this. Let me see. I think, oh, this one. Okay. And so it's the same picture here. Oops. Let me back up a little bit there.
Alex, while you're doing that, real quick, folks are really interested in your presentation today. Will you allow us to send out a copy of your slides?
Sure, definitely. No problem.
Excellent. Thank you.
Are you seeing, let's see. Let me see. There's my email. Are you seeing a web browser now that I'm scrolling through?
Yes.
Okay, and so this is, I was actually inspired to do this talk because of a podcast I heard with Dr. Katie. She's very passionate about peripheral neuropathy and chemo-induced peripheral neuropathy, and has so many great resources on her website. So it's drkatydpt.com. If you go there, she has a lot of information about herself, where she works, but she also has these great videos that she walks through that chemotherapy-induced manual therapy technique. So you can do it by yourself, as you can see here, or you can talk your partner or loved one into doing it for you. And she has it for the hand as well. And then also those ankle 4-way videos. Another resource that I want to point out is she has a little protocol. So sometimes it's like, how often do you do this is the question. And so she has that answer to with this protocol. And as you can see, that massage she has people do for 3 times daily.
Wow.
And so it is a time commitment, but she's getting very good results. The way that she described it was, the first week they say, okay, something's changed. I'm feeling something different. And then it kind of, nothing happens for a little while in between. But then towards the 8-week mark, people are starting to report improvement that is lasting. And so definitely a time commitment. But like you said, for people that are not happy with their medications, or the medication isn't working as well, maybe something worth trying. Is there any questions on that?
We do have a question from Janelle. And she said she could wait till the end, though. Now I'm just seeing this. I'm not sure how close you are, Alex.
Yeah, I am getting pretty close here. I'm gonna, ooh, that's not mine. Ooh, sorry.
I'm going to send you Janelle's question directly. You would like to answer that. So it'll show up in your chat box.
Okay, sorry. Let's see, I'm trying to get back to my slides here. There they are. And chat
There you go.
box, let's see.
Yep, I just sent it to you.
What is my Zoom? I'm not finding my chat box. Is it
Okay,
a personal
and-
question?
So yeah, in regards to, well, no, it's fine. In regards to modalities in cancer patients, what is contradicted? I'm unable to find concrete information on this.
Contraindicated.
Contraindicated, sorry.
Contraindicated, yes. All of the massage should be fine. The one thing you would want to check that we brought up today that you would want to check with your oncologist would be the TENS. So electrical stimulation may be something that may not be as appropriate depending. The thing about some of these modalities is it's hard to research because, there in theory is a possibility that it may increase tumor growth and tumor burden. And so depending on who you're working with, they may have different views on that. Again, it's not researched because of that slight idea that there may be some harm.
That's the most frustrating part for me because you want to err on the side of caution, but then at the same time, it's like, the Sabo, we use that with our chemo-induced patients, the Sabo bath. And
Yes.
we were always taught, oh, if you have active cancer, you're not supposed to apply electrical stimulation. And then there's just like all these gray areas. And a lot of the times I just have the oncologist either approve or disapprove. But I guess I get frustrated because I want to know the answer to that. And I can't
Yes.
find it. And it's
Sure.
like, well, if you're going to feel better, then, you want the patient to feel better. But at the same time, are we going to cause any harm by using these things, which is what we don't want to do? So that was my question. Sorry.
Yeah. And Janelle, are you a provider?
Yes, I'm a certified lymphedema therapist and a certified hand therapist.
Sweet. Oh, awesome. So I would direct you, there's a Maltzer article that has a nice table specifically with all of the different interventions. It's called, if you just Google Maltzer.
If you could type it in the chat and then I'll take a picture of it. I'd love to see it. Thank you. I didn't want to
Definitely.
interrupt you. Sorry.
Yeah, no, that's great. It's open access and it is, I'm not on my desktop. I'll email it to you. Do you mind putting your email in the chat and I can just email it to you?
Sure thing. Thank you.
Yeah, of course. Because that does help guide, your decision making. And, there's a lot of discussion that goes on with these because even specifically with like, if you're talking to people more and towards the end of life, a lot of these modalities that may cause growth in cancer, you're not worried about the cancer at this point, you're worried about their comfort. And so there is a discussion about even using some of them at those times. And so, yes, there's a lot of gray area and good team decisions is important.
So Alex, what I'm hearing, people can actually buy like home TENS units. So they probably should not be, in case any of you have those, probably it sounds to me like they should not be using those unless they really have a specific discussion with their providers.
Yeah,
correct?
the TENS specifically is usually accepted if it's far away from the actual cancer site.
Okay.
So that is one thing that is generally accepted. But again, if you have any concerns, please bring it forward to someone that knows your specific case. Yes.
Okay. That's great. Thank you. We have another question. And I actually was going to say something about this earlier. Is neuropathy linked to poor vision or restless legs after chemotherapy?
Yes, the short answer is yes. If you noticed in one of those questionnaires, it did have a eyesight component. You're thinking chemotherapy is systemic, and so it reaches all corners of your body. It especially affects those small nerve fibers, but it also affects the nerve fibers in your inner ear and your eyes. And so that is something that should be screened. That it's a little bit trickier to provide suggestions on what to do unless you're one-on-one. So that's why I didn't really go into a lot of depth on that. But yes, definitely causes issues with your balance if you're not seeing, or if you have some issues in your inner ear, that we also rely on that to know where we are in space. And so the short answer is yes. What do you do about it? That's kind of another thing that is a little harder to answer. Any other questions? Okay, I'm seeing the chat now. So good.
Okay, well, I'm just looking here in the chat. I don't see any other questions at the moment. Alex, you've been doing
Okay.
such a fabulous job of
Yeah. And if I
answering as
could,
you're going along.
if I could just make a little plug and a request of the group here today. I am part of the oncology support and education group at Madonna. We have a resource that's not really being utilized very well. And so we're attempting to do kind of a community needs assessment. And so everybody here today, I'm gonna put just a survey in the chat. If you would please fill that out. It is directed towards survivors, but for my clinical people on the call, just answer it as if what you would like to refer people to. If you see there's a gap in some way, please highlight that. So again, we have this pretty, we have a lot of, we have the space and the time. We don't have a lot of like monetary resources, but we would really like to provide what the Omaha community needs specifically. So, and even for my out-of-state people, we just want the more information, the better we can kind of sift through. So I would request that you do that.
This is really important, folks, and I'll tell you why. For example, I am chair of the survivorship committee for the Nebraska State Cancer Plan. And that is a 5-year plan. Every state has a cancer plan. And so when we are mapping out that plan, it's really important for us to be able to call on folks like providers like Madonna and all the different hospitals and oncology clinics to get their input. And so when they do things like this needs assessment, basically you're making your voice heard in a much louder way. And it does drive what the state is going to focus on and what they want to do for you in the coming years. So just as an example, for the Nebraska State Cancer Plan, we were hearing that a lot of folks feel like they're not getting the best information from their providers during their treatment. And so we want to know why, and we're trying to figure out, well, how can we increase that information and how it's distributed and how it's received, right? Our providers are very busy, and so hopefully we can arm them with printed information that they can hand to their patients or in between those visits, as Alex talked about. And again, she made that great advice of write down your questions and have them at the ready. That is also very, very helpful. So just one more, go ahead, Alex.
Well, and just specifically with the group at Madonna, we know a lot of people have a support group through their specific oncologist with their specific diagnosis. And so we're trying to see if we can build something that's a little bit more exercise focused, or we have a kitchen available. Can we do like a cooking group? So just trying to gauge interest and what is out there and what's not. So.
Exactly. And also just as a reminder, if you are new to A Time to Heal and you're unfamiliar with what we can offer you, we have our Survivorship 101 class. We're offering a new one pretty much every single month. It's on a virtual format and it's completely free. You're going to get a wonderful resource book, and it is a 9-week program, once a week for 9 weeks for 90 minutes. And you're going to be in a small group, no more than 15 folks at a time, all survivors and caregivers like you. And I know a lot of you folks that are on today have been through that program, have loved that program. And it is a great stepping stone to other programs. We do immediately talk about exercise. We recommend our friends at Livestrong. We recommend folks like at Madonna to help you out. We touch on all those things. We also have a brain fog program. It is fairly unique. We don't know of another one like it in the country. I really highly encourage you to take advantage of that as well. Again, a free program. It's only 6 weeks, again, virtual, and again, 90 minutes per session. And it really does help a lot of people that suffering from brain fog, whether it's from chemo, birthdays, or COVID. It does really help, and you've got nothing to lose because it's free. So, and this is all thanks to generous donors. We are 100% donor funded. We don't get any money from Medicare or Medicaid or the state or federal funding. Right now we look really smart because we aren't doing that, but we don't get any money other than generous donations from folks. So for those of you that are donors, thank you so much. Every gift really helps. Okay, well, everyone, thank you again, Alex, so much for this wonderful presentation. It's answered a lot of my questions. I hope it's answered everyone else's. Make sure you go to our website, atth.org, and look at again, if you want to sign up for one of our other programs, we have these webinars every single month. We will take a pause, though, in May, because we're having an amazing conference, and I hate bragging about it because for our friends that are too far away, I'm so sorry. You need to make a trip here for it, but we're expecting between 350, 400 folks at the moment. I think we have about 380 right now, and it's coming up on May 6th. We have 16 education sessions scheduled plus 2 keynotes. It's going to be an amazing conference. You can again learn more at atth.org. And also our friends at Livestrong. We love talking about them. No matter where you're at in the country, there's probably a YMCA near you, and they probably have the Livestrong program. It is free. For those in the Omaha area, you also get a free 3-month YMCA membership. How can you beat it? You can't. And it's a great program and very, very helpful. Okay. And again, also check out Madonna.org. They're doing great work over there. We're so proud to have them as part of our community. And feel free to email Alex with any questions, and I'm sure she'll follow up with you. So thank you all again. I hope you have, again, if you observe, I hope you have a wonderful Easter and a wonderful spring and a wonderful rest of your day. Bye-bye now.
Thank you.